are many factors that can contribute to joint pain, from repetitive movement like bending or squatting to sport injuries or accidents. The CDC estimates that about 54 million U.S. adults have arthritis. The Arthritis Foundation suggests that that number is likely higher and estimates that the disease impacts a greater number of adults younger than 65. So, Dr. Ray, let's look at what's causing that pain and what we can do to reduce it.
Well, first you have to differentiate between, I think we were talking more about the chronic inflammation here, because you can have an injury which is acute, something happens, and then you have what we call the dolor, the calor, pain, redness, swelling, and all that. So you have to get blood flow in there to get all these cells and enzymes to come in there to try to heal. That process takes place, and so you get there, you try to heal what's going on and all that, and that process stops. When that process continues, it now becomes chronic inflammation. So at this point in time, I think what we're talking about is more so people who are chronically inflamed, and now it's gone on to maybe they have some joint degeneration and all that, based off of the way that healing process took place in the first place. So now it's a delayed healing. And then you have to know why. What's causing it? Is this an exacerbation of a previous injury, or is this something new that's happened that's just continued to go on? Why is the person having this chronic pain? What is keeping them inflamed? Is it medical conditions, or is it prior injuries and all that? You just have to have a lot of reasons as to finding the why.
So sometimes I think people think, oh, this is just how it is and I have to live with it. And they may assume that, and they may talk to a physician that says, well, what do you expect at your age?
Oh, yeah. Well, no, I think you have to look at, you can do things to try to reverse things that are going on. You certainly don't want to do things to make it worse. Okay, so you don't want to just keep the movement there and go and exercise too much. But gentle movement and all that, if you can withstand the pain and all that, it's going to be good, because you want to reestablish blood flow, you want mobility and all that. The more that you sit there, the stiffer you'll get. That's no good either. And then,
Right.
Moist heat, things like that, saunas and all that. And also, there's some little cheap things like, red light. There's some little devices now that are pretty cheap, the red light and all that, they come in.
Yeah.
And that's
Yeah.
just little things that you can do to try to help relieve that pain.
I think one of the most underestimated places to move is the pool.
Absolutely.
There's access to pools all over. It's reasonably priced. But what I see is what you're saying. People that are in pain, and it takes a little bit to get it resolved. If it's going to get resolved, there's a profession called physiatry, sports medicine. And when I say that to people, have you been to see a physiatrist? They go, what is that? I don't know what that is.
Right.
And so pulling on different professions to help manage your pain, but don't stop moving. Wherever it is, just keep your body moving. I've seen so many people, because they're in pain, lay in bed and not go to a gentle yoga class, watch a video, just have somebody come over and do gentle range of motion. Just
Right.
keep your body moving, and then find ways. I might offend you if I do, I'm sorry, but if you have to take a little bit of medicine to help you move, I think I would like to see people do that.
Well, you have to do that because it's like anything else. We tell people after surgery, you have to have the deep breathing and all that. Do not do things that make whatever you have going on worse.
Right.
And so if you are in pain, you're not going to move. So you need to take medicine so that you can move.
Right.
To get to that sauna or get to that pool. And
Right.
it helps you to do gentle movement and all that.
That's right.
And it's the difference between chronic pain and, acute pain.
Right.
Acute is, I just got injured, and if I take care of it now, and I can heal it, then I can delay the way it's going to happen. And let's talk about just real quick the medication. So anti-inflammatories and ibuprofen, Advil,
You can
Aleve.
use those on a chronic. When something has happened to you chronically, that's probably what you're going to need. But if you just had an acute injury, those are going to delay the healing response. You don't want that.
So you want that inflammation initially.
Yeah, so the
to heal.
inflammation is
Okay.
good. That's more like aspirin or something, just to control gentle movement and all that. So that will help you to heal correctly so you can delay that chronic inflammation.
Okay.